Hello, everyone. Thank you for listening and welcome back. If it's your first time listening, welcome. Today, we are going to be talking about a subject we have not talked about on this podcast before, eating disorders. Eating disorders impact millions, including many children and adolescents. And some research suggests that girls with ADHD might be at greater risk. Joining me today is Robyn Goldberg, a nutrition therapist with over 2 decades of experience. She is also the author of The Eating Disorder Trap. Join me in welcoming her to the podcast.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Robyn. Thank you so much for joining us today.
Thank you for inviting me, Karen. It's a pleasure to be here.
I feel like it's been a long time. We've been kind of planning for this and planning for a coffee chat for a while, and it just hasn't happened. But now it is. At least this is the beginning.
Definitely. We're in motion.
Yes. And this is actually the first time we're talking about eating disorders on the podcast. So you are kind of our listeners' introduction to the topic, at least for on this podcast. So I'm so excited to have you here. I think when I was doing research for this conversation, I read that about 30 million people in the United States have an eating disorder. And I think 20 million are women, 10 million are men. Those numbers probably continue to change, but that's a startling number of people.
Yeah, I think people don't realize how common eating disorders are and that it affects all ages, all genders, all body shapes and sizes. And you can't look at someone and determine if they quote unquote have an eating disorder. When people perceive people have these difficult, I'm going to say food challenges, there's the stigma, right? Like we're all byproducts of diet culture and the messages that we're told. And unfortunately, a lot of it is false. And there's so much criteria that feeds into the diagnosis of an eating disorder. So yes. And the one thing I will say is also people don't realize that like your grandmother can have an eating disorder, your father, people that are not kids and teens and tweens and college students. And it's just everywhere.
Right. And contrary to what many people believe, eating disorders are not primarily about food. It's not a behavioral issue. It's really a serious, complex mental health issue. And that's why we're talking about it on this podcast.
Definitely. I think oftentimes, I always tell clients it is a behavior that has served a purpose for you, or it wouldn't be a behavior that you would engage in. So whether a person has a history of trauma, all types of trauma, whether it's abuse or, growing up by yourself, being bullied, being fat shamed, being stigmatized, being made fun of, your gender or your identified pronouns. It's been a way that a person has learned to cope with that discomfort.
Right. I'd love for you to share any kind of misconceptions about eating disorders and even why it's important to kind of shift the conversation to understanding what we mean when we're talking about eating disorders.
So misconceptions are, I'll tell you, like the classic is that eating disorders are in just, I'm going to use like the politically correct term, like smaller bodied, people with thin privilege, Caucasian women, like basically someone that looks like me, and starting at a very young age. And actually the most common eating disorder that's the least discussed is binge eating disorder. And you can look quote unquote normal. You can look like you're in a larger body and a smaller body. And it's the one that's definitely like thrown under the bus. It's actually, I would say 60% of women and 40% of men who struggle with disordered eating, let alone disorder, struggle with binge eating disorder. And the eating disorders that get the most attention, of course, are anorexia nervosa and bulimia nervosa. But, the other thing too, and it's, it came into the DSM of February of 2023 is ARFID, avoidant restricted food intake disorder. And that has nothing to do with like changing your appearance. It's known as like the picky eater. So oftentimes there's a sensory issue. An individual has some sort of trauma, like food got caught in their throat. Or I was listening to a client the other day and he was telling me that, now he has emetophobia, the fear of vomiting because he had the flu or got sick from chicken at some point. He's like, I can't eat anything that's solid or anything that is, he says, anything that had a mother, animal based. So like ARFID is very, very common and for so long would fall through the cracks. And now more and more pediatricians are informed about it. But I have many adults I see with ARFID and that it's limited them, whether it's like going out with colleagues for a lunch or dinner or happy hour, or the fear of traveling, because if you're in China, the food's going to be very different than if you travel to Arizona, let's say. So there's a lot of types of eating disorders, but unfortunately too, Hollywood has also put in the limelight the ones I referred to before and done it in an inaccurate, poor manner, like what residential quote unquote would seem like, or being in a medical stabilization program. And they have not portrayed them accurately.
Right. And I mean, you literally wrote the book on eating disorder called The Eating Disorder Trap. Were there like key messages that you wanted to convey to readers in that book, knowing what you know about eating disorders and your experience?
Yeah. Well, thank you for bringing up the book. So the book, Karen, actually came out the week before the lockdown. It was like May 30th of 2020. So literally like the week before. And I had, thought if I ever was going to write a book, I wanted to write a book that was not like, I don't want to say all the other books in my field, but that was different. They could bridge the gap that anyone could read, whether you're a new clinician, whether you specialize in disorders or not, a parent, a loved one, a coach, a religious person, a counselor. I wanted a book that was literally digestible to be able to read so you could have some preliminary data to help someone. And one of the pieces that I put in the book, and, I look back and think, my gosh, when I was a student, I wish there was a book like this for me to have. And it's resulted in a number of universities having it as required readings in exercise physiology departments, psychology departments, dietetics departments, because it's inclusive to all, but it's really like the students that are coming out and the AMFTs and the, people that are getting their hours to be psychologists, like this is the information they need. And it would really, like my book includes a lot of screening questions to talk about in your sessions. And for example, like my dentist, who I always say knows more about eating disorders than any other dental person I know because she's been seeing me for so long, she will say to me, Robyn, I know for years I didn't ask any of the questions that are in your book or other questions that came to my mind, because if someone would respond, like, I think a typical question that you would see on a medical questionnaire is like, do you have a history of an eating disorder? And many people will say no, but then like, I think to follow up, like, someone will say like, oh yeah, when I was younger or not for a while. It's like, okay, well, when was the last time you restricted, or when was the last time you engaged laxative and diuretic use? When was the last time you binged and purge? Well, okay. What's been your method of purging, or how often? Like people, especially clinicians, it's like we want to come across as like the expert and be confident. And if someone responds in a way that's like, oh, that's overwhelming to me, or I don't know what to do with it, it's sort of like they'll just avoid that whole conversation and routine of questions. So that was something I really wanted to include in the book. I actually also have, because I know many of the mental health care providers I work with, don't have a medical background. And I started my career at Cedars-Sinai. I was in cardiology and then in gastroenterology prior to starting my practice 27 years ago. So I was like to say, Karen, I'm a lab junkie. I love to look at one's blood work because labs don't always show everything. So like in the book, I actually talk about, there's like not one body part that's spared when you have any kind of eating disorder, whether it's binge eating disorder, bulimia nervosa, laxative and diuretic abuse, anorexia nervosa. And I get into every organ part, like the main ones and what happens. And I think that's important because if it's like, oh, I feel fine, it's sort of like understanding, like my doctor says I'm fine. Well, is your doctor trained in eating disorders? Because the only area of medicine that mandates training in eating disorders is adolescent medicine. So that means your pediatrician, your internist, your gynecologist, your cardiologist, they don't know about this. So therefore, oftentimes a person will say, I'm fine. My doctor says my labs are fine or my EKG is fine. But it's learning how to be trained to look at what all this comprehensive medical data shows so you can approach it through a different lens. So the example I always like to give is, if you had cancer, would you have your pediatrician or internist be your quarterback, or would you go to a specialist? It's like, oh yeah, I would go to a specialist. Well, it's like, this is the same thing with an eating disorder. You need someone that lives and breathes it. And the field is rapidly changing, like in all fields. And there's so much to grasp and be up to date on.
Right. And so, one of the things you're highlighting is the impact of eating disorders on your physical health. And we've also seen a significant rise in mental health issues among school-age children since the pandemic, young people, tweens, teens, and eating disorders are no exception. What has been your observation regarding the trend of eating disorders?
Good question. We need a double session, Karen.
We might have to get a part two.
Yes. So over COVID, with what you described, so many of the younger kids I see, not just, of course, like how to deal with Zoom and virtual school and the lack of seeing friends in person and all that, I think just contributed to the body image difficulties, compulsive exercise, restricting, using food to soothe. So definitely it increased. I think anyone that was in private practice like me was very busy. Or if you were, I've had many newer, younger clinicians that I've supervised that were like, oh, I'm going to go into practice. It was like, well, you just left working in treatment. It's like, oh yeah, it's such a busy time. So now I'm just 4+ years later, it takes work to have a successful private practice, not just, taking a leap over COVID. But yes, I think there's so much overlap and parallel between mental health, eating disorders that unfortunately over COVID, it was just accelerated to a level where, long wait lists in different programs. And I found for me, the biggest referral I made was a medical stabilization program. I'm not sure if you know what that is. But for our listeners that don't actually, so medical stabilization is the sickest of sick patients. So you're not appropriate. So the levels up here, there's medical stabilization, and then there's residential, which is inpatient basically. And then there's PHP, which is partial hospitalization program, followed by IOP, intensive outpatient program, which is the lowest level of care. And medical stabilization is your organs are not medically stable for you to be able to be in a residential program. So what these programs do is get your heart working, not over time, help you not have poop, bowel movements impacted, built up in your small intestine, being able to get your electrolytes stable so you don't have a heart attack or collapse walking from your bed down the hall. So that has been, I would say, over these last 4+ years, like my biggest referral is medical stabilization programs. And unfortunately, so many people I have seen, their families, their partners are like, oh no, they seem fine. They're okay. I think we should go into residential. Well, like oftentimes you're not even a candidate when you're going to screening. Like as Dr. Linda Shack, who is one of the people I work very closely with, she is the physician who runs the Torrance Medical Stabilization Eating Disorder Program. And as she always says to me, like, Robyn, we can only make recommendations. And like, even if a person's coming out of medical stabilization and then it's recommended residential, one of the biggest like problems is when one will say like, you know what, like, we just want to find a team. We're not going to go into residential. Like, that's like a conflict of interest. That's a huge liability issue, especially if you're not at the point. Like, there's a reason why that recommendation was made to be able to step down to residential, not let's find an outpatient team. So yes, definitely mental health, eating disorders just through the roof, as you said.
And I'm thinking about, I mean, obviously you get to the point where medical stabilization is needed. But before then, if we back up, are there early warning signs that parents should look out for that might indicate that their child, their tween, their teen may be developing an eating disorder?
Yeah, I think one of the problems I just want to highlight, Karen, is when a parent hasn't resolved their own issues with food and body. So they're normalizing like, this is fine. Like, for example, when a child will be like, okay, I'm not eating carbohydrates. Like, that is a red flag. Like, we all need some carbohydrates, some protein, and some fat. And especially when the parents are chronic dieters and they're like, oh yeah, I'm not eating carbs, or oh yeah, that's fine. And you're eating quote unquote real healthfully. You're just eating protein and vegetables. It's like, well, then what happens is your child is more moody. They're having a harder time concentrating. They are constipated. Not to mention, hair could be thinning or falling out. They're having bruising all over their lower extremities due to low blood sugar. So I think cutting out a specific food or food group is something to pay attention to. Also, where they're like, they won't go to a restaurant. They won't go to a family function. They want to just prepare the food themselves. That is a problem versus like your parents making the food or ordering takeout, or we're going to grab something on the road for the road trip, where it's alarming to them and very distressing to be able to be flexible and adaptable in these situations. Another is eating by themselves. They will not eat with people. They want to eat in their bedroom. Again, I think this has just been like accepted, normalized. It's like, oh, this is what my child does. But, growing up, Karen, it was like the only time we ever ate in our bedroom is we were sick. And I remember my mom would bring like a TV tray in bed.
Same. Yep.
Yeah. Otherwise, it was like my brother and I, we were at the table with, hopefully my dad was in for work. Yep, exactly. My mom. And no TV was allowed. There were not any devices at that point in time. But it's really stressful for many people I see to sit with others or eat what someone else is making, to not eat by themselves, and also to eat food that's unknown to them. Like, I don't know how it was prepared. I don't know what was in it. These are big warning signs. And the other is like, I need to go on the Peloton after dinner. That's a problem. It's not like, oh, I'm, getting rid of stress. It's like, that could be a sign of like purging via exercise, or I feel guilt that I had this spaghetti and meatballs tonight. It's like, learning how to be able to like sit with your fullness, because there's different levels of hunger and different levels of fullness. And again, I'm just like touching upon, there are a lot of warning signs. And I think what happens, Kieran, especially like over COVID, and even now when parents will call me, oftentimes it's a emergency dire situation because they've missed all these warning
things
signs
that you're talking about, right?
Yes. And oftentimes then they're needing more support because they've gone too long.
Right. And it's interesting because one of the things you said was that, you know, depending on the type of foods you're taking in, it can impact your ability to focus and concentrate. And there can also be, you know, symptoms associated with anxiety and depression in individuals who have an eating disorder. So there can be a lot of overlap, which also may lead people to miss things and attribute some of these things to depression. You know, they're not hungry because they're depressed, or anxiety or something else.
Well, two things I want to say on that is, one is the anxiety and depression can be increased when you're malnourished. They may have had it before, but it's just heightened. And the other that falls through the cracks time and time again, sleeping difficulties. For example, you may have struggled with insomnia or sleeping through the night or falling asleep or being able to sleep in. But when you're not getting enough food, it is worse and it is harder. Like, you have to work that much harder to engage and connect with people in school, to be able to hear what the teacher is saying to you, to not like the other thing is, you say your mom was like, oh, do you want to go to such and such after school? Boom. They could just burst out crying. It's like, well, what did I say? They're that emotionally sensitive and fragile due to suboptimal nutrition.
And that's really interesting because some of the things that we were talking about, kind of that dysregulation of emotions and lack of focus, can also be seen in things like ADHD. And I think I was reading some research that shows that girls with ADHD are actually 4 times more likely to develop an eating disorder than girls without ADHD, which is really interesting. And so again, if it's a girl with ADHD, they may attribute some of these difficulties to the ADHD and not see that this person could also have an eating disorder.
Correct. And because like maybe they had the ADHD before, as well as like disordered eating or thinking, but it doesn't take much to push a person over the edge to the other side. And then it just spirals. Like I would say, it's like Alice in Wonderland. You're in this dark hole and all of a sudden it's like, how did we get here? Because you think that you can control it, but Ed or Edwina, or the quote unquote eating disorder voice, the eating disorder voice doesn't want you to succeed. The eating disorder voice wants you to fail. So therefore, it's like all of a sudden the team is assembled in a very aggressive, short period of time, because it's not something that one can pull themselves out of. It's not something that can be done alone or a family can do alone. Like, it takes a village.
Right. And it can be hard for parents, even with knowing some of these warning signs that you've mentioned. It can be really hard for parents to kind of detect what is normal, what is something that they should be concerned about with regard to eating or exercising. And even I'm thinking again with the young people with ADHD, it can be hard to differentiate between what is appetite suppression due to stimulant medication and what is the onset of an eating disorder.
And with the stimulants too, Karen, that can just literally feed into the restriction, or it's quote unquote easy to exclude a specific food or food group, or bypass a meal, or push when I'm having that first meal too.
Absolutely. And I'm just thinking, you know, are there steps and guidance that you give parents if they suspect that their child, their teen is struggling with an eating disorder? Are there things that they can do as first steps to engage and then seek help for their teen or tween?
Yeah. So the one thing I want to say that's so important is, and I actually have a free online course for parents, partners, and caregivers that have a loved one struggling. So my course, it's called Your Recovery Resource. It's free with 35 modules, videos, and handouts. And parents oftentimes feel like, I don't need therapy. I'm fine. It's like the way we communicate verbally, non-verbally has a significant impact in how your child is responding. I mean, I think seeing your own therapist and seeing your own therapist that specializes in eating disorders is very, very important. But I'd say that course is like definitely needed. It was developed by myself and my colleague, Becca Clegg, who is an eating disorder therapist in Atlanta. And over COVID, we created it. So that's just one thing I want to say. I think also being able, and oftentimes, their doctor might not have the best resources, but asking the pediatrician and or their internist, do they have a referral for an eating disorder therapist, an eating disorder dietitian? Many times people find me through, like, since I was on staff at Cedars-Sinai, as I mentioned, their physician, and their physicians know that this is what I specialize in. But a lot of, I think, doctors assume all dietitians specialize in eating disorders. No, it's unfortunately another area. It's like, okay, we had one semester in school, but that's not even, it's like, I've worked in treatment. I've been mentored by the best, Dr. Ed Tyson, who's an amazing adolescent medicine eating disorder physician in Texas. And for years, him mentoring me. But I think that the truth of the matter is, like, having a clinician that is knowledgeable and an expert and seasoned, because then they can help create the team and give you other people to consult with too.
Right. And it's interesting because I think parents might be hesitant and not know how to approach their teen or their tween or their child when they suspect that there is an eating disorder. And it seems, I think, that from what you're saying and from the work that you do, that it's important to be supportive rather than confrontational, which may be the instinct.
Yeah, I think it's like being able to bring up, what I'm concerned. You've not been able to sit with us at family meals. Or I have a client, and she told me that her friend at school had said, yes, you know what? I know there's something going on with you. And at first my client was denying it. And then her friend said, I understand. Like, I was in the hospital for an eating disorder. My sister is struggling with one. And so my client had said to me, she's like, I felt so relieved that, like, my best friend understands, and we never discussed this before, and I didn't know this about her. So there's oftentimes so much shame. And that brings up, I always like to say, asking the school psychologist or counselor for a referral. But oftentimes I hear parents say, like, we don't want the school to know that, our child has an eating disorder. But I think it's important, because especially if they are not, medically stable to play a sport, or they need to leave a class early for a therapy appointment, or, dietitian appointment, or doctor's appointment, I think it makes sense for the school to know.
Absolutely. And they can be on the lookout for warning signs or indications of medical crisis and situations where that young person would need immediate attention.
Yeah. I mean, I think also, like, as we're speaking about this, I think oftentimes warning signs are oftentimes not, the lack of awareness is limited, just with being able to support, but with what they see, for sure. I just think it's a way to be able to go up to quote unquote Sally and say, just want to check in and see if everything's okay. I notice that you're sitting by yourself while your friends are sitting at the lunch table eating or hanging. I think it makes a lot of sense. But when you're in it, you don't oftentimes think logically. Oftentimes people think irrationally.
Right. And I mean, you mentioned a number of different types of eating disorders, some that people might be aware of, bulimia and anorexia. You also mentioned, binge eating disorder and avoidant restrictive food intake disorder, or ARFID. So that also means the treatment is going to look very different depending on the type of eating disorder. What should parents expect if they're thinking their child has an eating disorder, they're looking at maybe seeking treatment. What does that typically look like? And again, I know that it can look different depending on the type of eating disorder and the severity of it.
Yeah. I mean, with seeing an eating disorder-based registered dietitian, I would say it's a series of sessions over a period of time. Most clients I see weekly, like if they're requesting multiple times a week, then they're probably needing a higher level of care. And when a child's not able to follow through with the goals that we set, like it's pretty apparent after, like, let's say a month. Then, and also too, I always create a team if they do not have a team, because you can't just see the therapist or the dietitian or the doctor. You need to be able to have these specialists. Sometimes a psychiatrist is needed, and that referral would come from the mental health care provider. And the other thing is too, like I'm thinking of someone I'm seeing now who came to me from the pediatrician who's non-eating disorder specialized. And I had told the mom I really wanted her to see a doctor that's an eating disorder specialist. So now it's like, okay, I've got the doctor who's my counterpart. And she's like, well, okay, she's plays soccer. It's sort of like sometimes the parents don't have their priorities in order. It's like their heart rate's very low. They're not at a place that it's, medically recommended to do an activity that elevates their heart rate. So there's that piece, because it's going to be multiple appointments. And I know the school year has just started. So that's overwhelming. Like, oh, my child's in the play. They're, in orchestra. It's sort of like some of these things need to be put on hold because, the research shows it could take 7 to 10 years to get to a point of being fully recovered from an eating disorder. And that's if you're actively utilizing and working with a team that is eating disorder trained and specialized. Otherwise, it could be a lifetime if you're fortunate enough to live a life. So I would say it's a variety of appointments. Like for me, I see clients once a week. I will oftentimes bring on a meal companion coach if they're having a difficult time following through with the guidelines that we're creating at meals and snacks. And this is the other reason why I think it's important for the school to know is, like, if the meal companion coach is like coming to the school and then the client, they're like going off campus and the person's having the meal with them, or it's just helping them be able to immerse back into real life.
Right. And it just seems like it's a very comprehensive approach to treatment. And that's what is needed in terms of the medical oversight, the work that you are doing, a mental health professional, the school, and obviously the family as well. Are there things that family members can do to support a young person with an eating disorder at home?
Get rid of your scale in the house. Don't talk about, well, this is what I follow and this is what works for me, as hard as it is. Put a piece of duct tape on your mouth. It's, also don't talk about, quote unquote, oh, I feel fat. Does this outfit make me look fat? Or, oh yeah, I just started Ozempic. That's like a whole other problem, Karen, is like, I'm listening to clients that are speaking about like, yes, you know what? My dad, my mom, they're on these, medications and they're not eating me, or I'm finding, how come I'm eating more than them? It's like, you know what? Well, we're just comparing yourself gets you, but also you're a growing child. So it's very activating. And that was the reason I said before, for parents to really address their own relationship with food and body, because diet culture, no one is immune from it. And it's all over the place.
Absolutely. And it feels like, we've had conversations, on this podcast about social media and technology. And it seems like that can also contribute. The exposure to social media and what other people are posting and what other people are doing can also contribute to that culture, that diet culture.
I think taking a social media break, taking a technology break other than for school, because you can't believe everything you see on social media. And influencers are not trained clinicians.
And so much of the information is false that is on social media.
It's very deceiving. And it's like luring you in. It's like, you don't have to drink the Kool-Aid.
Absolutely. Absolutely. I mean, there's so much great information that you shared in this conversation, Robyn. I think our listeners have gained a lot of important information about the complexities of eating disorders, how to recognize the early warning signs. And I think your book, The Eating Disorder Trap, is going to be an insightful resource for families, for clinicians, and for individuals navigating these challenges. So I cannot thank you enough for joining us today and sharing your expertise, because this is such an important and critical topic. If listeners want to reach out to you to learn more, to connect with you for a consultation, for work for themselves or with a family member, what is the best way for them to connect with you?
Thank you. Well, I'm old fashioned. I always like to say the phone. I'll put it all out there. My office number is 310-273-0413. My website is askaboutfood.com. My book website, which is actually linked as well to askaboutfood.com, but it has my podcast, the Eating Disorder Trap podcast, and my book. I have a book podcast. It's the eatingdisordertrap.com. And I can be found on Instagram. If you are not taking a social media break at the moment, my Instagram is Robyn with a Y, Goldberg, RDN. Those are the main places you can find me, but I'm all over the web. So it's pretty easy to find me as long as you type in Robyn with a Y, Goldberg, RDN.
Wonderful. And I will be sure to put all of those links in the show notes. So if you're listening, be sure to check out the show notes so you can get in touch with Robyn and learn more about all the work that she's doing. Robyn, thank you again for being here. I appreciate all the work that you're doing.
Thank you so much, Karen. I enjoyed our conversation.
Me too. Before we wrap up, I want to remind you to visit childnexus.com, where you can sign up for our email list and access resources that can help guide you through challenges related to child and adolescent mental health and learning differences. We are here to support you with expert content and a consultation if you need a personalized approach. Be sure to check it out. Thank you so much for tuning in, and I look forward to having you join us next time. Bye-bye.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.